Welcome to everyone who's joining. Great to see you today or have you join. Okay, I think we are okay to get started. Thank you so much, everybody, for joining today. My name is Laura Gordon, and I will be moderating our session today. And we have Dr. John McGrath joining us, as well as Dr. Miles Sargent. Really delighted to be here with you today to kick off our climate action piloting tool. Next slide, please. So we wanted to keep this discussion fairly open. We don't have a ton of slides because we really want to be able to answer your questions. We will spend a little bit of time exploring the new benchmarking tool. This is a pilot version that we're so delighted that you've signed up for and showing your leadership in this space. We'll go over some timelines and the completion process, just more from an operational perspective, what it is that you actually need to do to submit. And then we'll open up the floor for your questions and answers. And this pilot is directly feeding into an evolving tool that we will very much be looking for your feedback to improve it. So it's really critical that we hear from you, and we're so delighted to have you join us on this journey. Next slide, please. And so I'd like to begin by acknowledging the land that we gather and work on, and by expressing our gratitude. The HSO head office in Ottawa is located on the unceded traditional territory of the Algonquin Anishinaabe people, and we are thankful to live and work on this land. And we recognize the ongoing relationship between Indigenous peoples and these territories. And if you so wish, please share in the chat the land you're joining from us, or you're joining from today. We have folks calling in from all across the country. Next slide, please. And so I'm delighted to turn over the floor to our panelists today, who will be walking us through some of the presentations. So as I mentioned, Dr. John McGrath, he is the lead of this project from HSO. And we've partnered with Dr. Miles Sargent, who's the executive director of the Canadian Coalition for Green Healthcare. So we've got a powerhouse team here today. And I think I'll just turn the floor over, John and Miles, if you'd like to sort of explain your role and your background. Thanks.
Thanks, Laura. Why don't I go first? John McGrath, Executive Vice President at HSO and Accreditation Canada. My background really is I've spent a lot of time in have a graduate work in neuroscience, and I also spent a lot of time in ecology and animal biology. And after that, drug development and medical device development, bringing products to market, and laboratory and imaging services. So I come to HSO. I've been here a little less than 2 years, and I come with the experience of bringing products to market, a long history of being involved in healthcare, more from working with organizations from a systems perspective, or bringing products in to deliver healthcare, as I mentioned, but also a passion for the environment, and one in which I think this is a great intersection. So that's where I come from. And Miles.
Thank you, John. Thank you, Laura. Thanks, everyone, for coming. I'm Miles. I'm a family doctor in Hamilton, a bit of an unusual career, work at Hamilton Health Sciences within the complex care division, and also do addiction in Hamilton's inner city. I work very part-time now clinically because I do climate work full-time, and I think some of you know that I have a few hats, and probably the biggest one is the executive director of the Canadian Coalition for Green Healthcare, which has been around for 25 years and has done all kinds of wonderful things in this space. And I took that ED role 2 years ago now. Back to you, John.
Great. If we could have the next slide. So we really at HSO and Accreditation Canada have announced our intention to have a green strategy, one in which we have kicked off with assembling a climate advisory committee, which we announced in January. In April, we announced the partnership with the Canadian Coalition for Green Healthcare. And they've had a tremendous experience in this space, and one in which they've had a tool to measure and a benchmarking tool. You'll hear a little bit about where we're going with that in a revision to that. But I think it is part of a journey that we're on here. This is not this pilot that we're working on and this tool that we'll be coming out with is just a step in a multi-step journey in this space. And it's not one, I think, when you're participating, and we really appreciate everybody's interest and participation and the feedback that we'll be getting and incorporating that into the revision. But I think it's important to know that we are on our longer journey on this and enabling organizations to really lean into areas in this space with how they want to approach it. And how we're approaching it really is fundamentally based on a team of experts, the people that have experience in this space, but also have tremendous breadth of knowledge, and also building on what has previously been done and the insights from that. So next slide. So part of this is what we're looking at or working in the green space is really looking at addressing climate mitigation, resiliency and adaptation, and disaster reducing risk associated with disasters, and also recovering once those have occurred. And I think when in climate space, we've seen a tremendous impact of extreme weather events that have occurred. We've seen a impact of that would be wildfires in northern Canada. It could be flooding in Calgary. It could be a variety of things, hurricanes, and as well as this also displaces people. It displaces people, so migration of people having to access healthcare services. It also can destroy healthcare facilities or damage them, and how quickly we repair them. And so these are all part of climate change, but also addressing things like health inequity, because people that are marginalized or have sometimes the least amount of resources are impacted the greatest, because they don't have the resources to move, or they don't have the resources to even get an air conditioner. They don't have the resources for some of these basic things. So we're together approaching this with the focus on, when we look at this, how can we potentially reduce costs within the system as part of green, which increases in efficiency, but not just to keep quality, but to increase quality. And cost reduction may also be things like time spent on freeing up time. We have examples of that, and we're collecting more examples of that. It also is about making sure that services are continuous. We're seeing right now is the disruption of the supply chain, as an example. So this may be due to a variety of reasons, but supply chain gets disrupted, especially when you've had a fire or some sort of event, however large. We're seeing that right now in both pharmaceuticals, in disposables, and a number of places. And so not only could a building or a healthcare facility be affected, but it's also about making sure that when you are delivering care, you're delivering care in a consistent manner, and you're able to do that under a variety of scenarios. And then furthermore, if there is something that happens of perturbation, how quickly can you get back into your facility operating? And we were just visiting a site. Actually, I was just visiting a site last week in Hay River, the Northwest Territories. There they had dealt with 2 wildfires and a flood in 3 years, and how you have to manage moving patients around throughout the province or other provinces rapidly, how you have to manage your supply chain. There's a bunch of things that happen. This is all part of of climate change. So that's the approach that we're taking with these tools that we're developing and how we're entering this. The overarching focus is really about patient safety and delivering high quality healthcare in a number of circumstances. Next slide. So we have we're developing a benchmarking tool really to focus on driving impact in this space, measurable impact. And so with that, we have our standards and required safety practices that have been announced in April. Those standards we'll talk a little bit about. We are focused on collaboration. We can't do this alone. And there are over 80 organizations in Canada dealing with healthcare and green and the environment alone. And trying to, this collaboration we have talked about today is just the beginning. We are looking at how we can extend this and take measured steps to collaborate effectively across the country. And with that, we also have to measure what we're doing, and that derives impact. And so when we bring all those three things together, that's also what's going to drive impact. Next slide. So I think what's important for everybody to hear, and we keep saying this, we announced a benchmarking tool. This is not a mandatory program. And this will not affect your accreditation. I want to make sure that's clear with everybody, because I think when people hear, Accreditation Canada is coming out with a climate benchmarking tool, probably the first question is, well, is this something else we have to do? And we are making this tool in consideration of, we are focusing on how our standards get developed, how our RSPs get developed. And if you are following our standards and specifically are adhering to all the RSPs, there will be some crossover. That being said, so just by conducting your normal course of business, there will be some applicability to our climate action benchmarking tool. And so why we were thinking about this is not to add, not everything is done in isolation. We are in consideration what we're doing with all of our products. But organizations that really want to change, that want to have a green strategy or want to affect change in various areas, they have got a bit of a head start, or it's integrated for what they're doing already. And it's our view is to enable people to take incremental steps forward. And I think what the important thing is what we've heard too from a variety of groups, including one we were at the CCHL conference last week, which was, there are, as I said, so many organizations out there doing things, which is fantastic, and they're all bring tremendous value. It almost seems a little overwhelming for some of where do we start. And so our objective is to simplify, start off at let's give everyone a playing field in which everyone can approach it and figure out where they're at. And that's what Miles is going to talk about. But where we're going in the future is to then provide more tools or a more comprehensive approach to layer on top of that once you have a starting point, that you're able to advance in the ways that you want to. So we're really trying to make this accessible to everybody. We're really trying to enable people to sort of benchmark where they are without a huge amount of time investment, and Miles will talk about that. But the first step was really trying to get everybody on the same page, and then later on help you choose where you want to go, because every organization has a different population, has a different place in the country, has a different infrastructure, has a different budget. And it enables organizations to be successful on how they want to be successful, given their constraints, resources, and opportunity. But bringing that together, that collectively as a country, we can begin to make a difference. And we're already starting to see some of those changes occur. So that's really fantastic. So with that, Miles, I think you're taking over the next slide.
Yes, thank you very much. If we can go back to the mountain climber, there we go. Yeah, so the coalition under Linda Barangu's leadership in 2013 was working with the Ontario Hospital Association with their first Green Hospital Scorecard, and then it got passed to us to administer in 2016. And so we've been doing this every couple of years ever since then. I think quite a number of you probably have done the previous one. Next slide, please. What I'm going to call the original Green Hospital Scorecard, although it has had a couple of renewals, would take a facilities person 5-6 hours to fill out, and it was purely voluntary. So you can imagine we would get about 100 hospitals filling it out, which is a pretty good commitment. And then, of course, you can look at your score from year to year, and you can compare yourself to hospitals of a similar size. So in terms of rethinking the whole thing, one thing that clearly we wanted to do was to make it not as deep a dive, not into all the metrics that the original one looked at. So this is a shallower dive. And in terms of the pilot, the people who are at the talk today, probably many of them, 45 hospitals did sign up. And we had quite a range of hospital types, from acute, non-acute, and as you can see there, from 15 beds to 800 beds. Next slide, please. Okay. So what are we going to do next? As it stands right now, the scorecard that you're going to look at in the pilot has 51 questions. This could change if some of you really dislike a question or think we're missing something. There could be more or less. The original one had over 200 questions. The answers to the questions are pretty simple. Essentially, we're not doing this at all. We're doing this a bit. We're doing this a lot. We finished that project, moving on to the next one. That's essentially what the questions are shaped around. And once again, it'll be anonymous, but we will be able to share from year to year how you're doing, and also compare from site to site in terms of sizes of hospitals and where you sit. Next slide, please. The low-hanging peach tree. For those of you who've seen this a number of times, go ahead and have a bio break. And for those who haven't, this is the low-hanging peach tree, which we published in Longwoods about 3 years ago. I would say most of these items are probably mentioned in the 51 questions. If you have not seen this before, this is essentially a 200-bed hospital that you're looking at, and we categorize the initiatives you can take around decreasing your carbon footprint in terms of color of the fruit. The orange ones are the ones you want to go after first. They have over 100 tons of CO2. You may not be building a new building, and so that one gets crossed off the list. You can see there's a cost scale on the left. We're also kind of comparing apples to oranges here. One thing I always like to point out is around 10 o'clock on the tree, you see EV chargers. The hospital I worked at, we got exactly 4, just as it says there, EV chargers times 4. It cost us $30,000. It is a green fruit. It is less than 50 tons of CO2 per year, whereas something like deprescribing, bottom right, and we modeled 5%. If you can decrease your hospital meds by 5%, not only will you save about $500,000, it is one of the big orange fruits in the tree. So we just encourage people to go after the big ones first. They are all important. A lot of them save money. And in fact, some of them, we have Energy Manager there at 2 o'clock. An Energy Manager might be $100,000 and will save that amount of money within the first year of working. Upgrading boilers is a small fruit. It's an orange one. It's a small one because the return on investment is not within a year. It might be more like 8 years, depending. Next slide, please. So these are the categories. You'll see there's actually 3 under building. If you lump them all into one, there's essentially 10 categories. I think these are some of the usual suspects, probably not a lot of surprises here. So there will be, you can see how many questions we have in each category at this point, but this is subject to change. And finally, system design is primarily about the fact that we need to find ways to allow people to age and die at home and decrease length of stay. And there's clearly many different ways that we can do this, but with an aging population, certainly something we need to think about, focus on. And I think that's it for me. Next slide.
Great. Thanks, Miles and John. So we actually have a little poll for people. As Miles mentioned, many of you have likely completed the coalition's previous scorecard. So please take a moment and answer the poll. Have you had a chance to complete the previous version of the coalition scorecard, or are you using another assessment tool? Please go ahead and complete the poll. There's a QR code to access there. So if you just hold up your phone, if you're not familiar with the Slido polls. All right, that's great. So almost half have completed the previous version. So as John and Miles are mentioning, this is a scaled back version. And it's designed to be really a baseline assessment. So really working hard to try and find the right balance of not having it too onerous and getting as many hospitals to complete it as possible, while also making sure we're covering all the key topics. So I think we can move on to the next slide. Thanks everyone for participating. Okay, so this is really getting down to the nuts and bolts of the tool. So yesterday you would have received a letter inviting you to access the benchmarking tool. If you did not receive that, my colleague Carlene had posted it in the chat, so you can link directly to that Cognito form. And that contains all the tools. And you can go through each section. When you signed up to participate in this pilot, you would have indicated which sections your organization wants to complete. So please go ahead and complete those sections. And if you are interested in doing additional sections, you're also welcome to do that as well. We will walk through a visual of this in a moment, just so you have a sense of what it looks like. Once you've completed your sections, you simply click submit, and that will get saved to the coalition's servers. And then the last step, and this is the really important one for us, is there's a link to a survey, and it's a usability survey asking you about your experience with the tool. It is a very short survey, but we really would appreciate it if you are able to give us feedback so we can make those adjustments to the content, to the length, topics, etc. And there's optionally the ability to sign up for an interview as well. So if you'd like to share more about your experience directly with us, we will be looking for a sample of participants to do that. And the last step is, once the pilot concludes, we will be preparing a short benchmark report. So we will need to compile all those results, and we will be sending that to individual participants. As Miles mentioned, we will not be identifying any organizations directly. It's anonymous in that comparison. So I think we're just going to show the tool right now. Carlene, if you can please tee that up, just so people can see a visual. All right, so once you click on that link, the general information you'll complete at the bottom of the screen, and that's just your name, organization, etc. Some basic contact information, and then you can click save. So what's really great about this tool is you can save it and come back to it. You are able to copy that link and save it somewhere, or you can email yourself the link. So if you do not wish to complete the tool in one sitting, you're welcome to save it and come back to it. And then, yeah, so you can just move through the tool in the different sections. And if you want to go back to that main menu, you can just select the sections that you signed up for. So I'm just going to, yeah, we can repost the link, no problem. Yeah, so at the end of each section, we've added an optional open-ended question. So if there's anything that you'd like to share about that particular topic, you're welcome to do so. Again, because we have scaled back the number of items in the tool, there could be things that you're wishing to share that you might not have been able to do so in the quantitative sections. Okay, thank you, Carleen. I think we can go back to the presentation. And Carleen, if you are able to just maybe repost the link to the Cognito form, that would be great. Sorry, I'm asking you to multitask many things. Thanks, Carleen. Let's give that a moment there. I actually probably could have, okay. So we're also, if you require support, there's a few different ways that you can do that. So please email the climate action inbox. So I will be monitoring that and triaging questions as needed. So we have a fantastic support team in the background here. On the coalition side, we have Autumn, who has been just remarkable with setting up the Cognito form and helping us out with all the technical pieces. And of course, Linda and Miles from a content perspective. So happy to answer your questions as quickly as possible. And then we'll also be holding live office hour sessions. So these are two optional drop-in sessions. One is Friday, July 4th, and the other is Thursday, July 17th at 1 p.m. Eastern. So if you have questions that can be content related or questions on the technical side, please join one of those sessions and then we can benefit from the group learning from one another. So you're welcome to do that. Next slide, please. So yeah, we have an open Q&A section now. So if people have questions, we'll open up the floor just so we can get started. So does anyone have any questions? It's quite a straightforward tool, I have to say. So
So people, I think, are raising their hands.
oh yes, okay. Thanks, John. I'm not actually seeing who it is.
Unmute.
Okay. Anastasia, great. Please go ahead.
I don't think they can unmute.
Hello?
Hi.
Hello.
Oh, great. Thank you. I was just typing in the chat that I couldn't unmute. I appreciate it. I have a couple of quick questions.
Yeah,
So
go ahead.
my first question is for an organization that has multiple hospital sites. I know that at the very first page, we need to submit whether we're acute, non-acute, et cetera. Would it be preferred that we submit separate submissions for each hospital site or just one kind of big organization-wide submission?
Miles or John?
My preference, but these are all great questions, is that if possible, we submit per site. I think that there may be some differences per sites or sites may change. Miles, has that been your experience?
Well, if Linda is still on, I would defer to Linda. Again, as the I'm going to call myself the rookie ED here. I've not been. I was not here the last time I was administered. Here comes Linda. Save the day.
Hi, everyone.
Linda.
Yeah, we've been trying to keep it per site, and I think there will be an evolution, I believe, of this particular activity, and there may be a point where it becomes a system or several hospitals under one umbrella. But right now, it's per site. And as John mentioned, even when folks submit for, let's say they have 5 sites, even when they submit on these 5 sites, we've noticed in the past that there are differences and they could be significant, maybe not under governance and things like that, but certainly site-related things. So yeah, it's per site right now. Looking forward to an evolution though too.
Right.
Okay.
Thank you, Linda.
That's great. Thank you. Sorry, I have just a kind of a separate
Go
part to that
ahead.
question. I was wondering, and I know somebody else put a similar question in the chat, but was there a specific reason why the reporting for the actual energy, water, waste, and other emissions data isn't included in this tool? Just out of curiosity.
I can try, Miles. Yes, this is to be a baseline. So we had 100 hospitals responding over the last several years, but there's 900 other hospitals who it may not even be on their radar. And if we were to ask a lot of questions that were perhaps scaring them away from responding, then we wanted to avoid that. So at this point, we haven't asked for specific quantities, but this is what we are calling a shallow dive. And we're hoping to have a deeper dive available as well, because there are so many really excellent people that are doing excellent work on this topic. And I know that this information is available to you guys, but it may not be available to the others. So deeper dive coming soon.
Super. Thank you very much.
And I'd like to just follow up on that one piece. I think we're taking an approach on this as Linda said, to start off, make it as universally as approachable as possible. But we're using this time in between and having a more comprehensive, deeper dive, looking at what that might look like in the future, which might be more analogous to the previous hospital scorecard that people could do after they've done the simple one and decided they want to go the next step further. We are also recognizing that in some cases, there may be some opportunity to collaborate with other organizations that have this data on behalf of organizations, whatever that might be, and how they can sort of, maybe not right now or not next year, but we're trying to think of ways to reduce the collection burden of information on people in general. And so those are, and it may not be the same for across the entire country, I should say. But I think that we are, as you said, making it accessible, using this time to think about how we can automate for organizations the process of collecting data over the next couple of years, and then using that data to help them drive decision making. That may be a bit of a stretch, but that's the intent. And we recognize that we don't want to just keep making tools or collections or assessments that are overly burdensome, and we're trying to drive impact that way.
Look, great answers, Linda and John. Yeah, I don't have a ton to add, but yeah, absolutely agree. This is a shallow dive. I want the hospitals that are leading the way to keep leading the way and keep raising the bar for those hospitals as well. So yeah, I hope we have a deep dive sooner than later.
Great, thank you so much. So we're having a few questions related to having a soft copy of the tool.
Autumn?
Yeah.
Oh, sorry, John, go ahead.
No.
I was just gonna weigh in on that point actually about the PDF copy. If everyone here who's organizing it is comfortable with it, so I can send PDF copies of the surveys out just so people can review, anybody who would like it. But I think we would like to request that your answers are still input in the Cognito forms, just so we have all of the data in one place. But just for your reviewing purposes with your team members, we can definitely send along a PDF copy.
Anything
If
else,
that's okay with everybody else.
John or Miles?
I think with a PDF copy, this is a draft copy, and it's, I think, something, and then that it's not something we hope people post this online. We're still gathering feedback in the pilot stage. So we'd also like to understand, when we even requesting the PDF copy, to think about what's the use case, what are we missing that or how is our approach and the way we're collecting data not easily accessible to your institution, how you intend to. So once you reviewed the questions and you're going through it, that's for us to understand too, is what problem are we trying to solve here by having a PDF copy versus a tool that people can use. So that's just something we can share, but also probably on the feedback.
Perfect. Thank you. Okay, Caitlin, over to you. I think Carlene will unmute you.
Yep, great, thanks. Yeah, just to piggyback on the PDF, the reason I would be using it is because I'm getting input from a variety of different departments. So if I don't get the PDF, that's fine. I'll just take screenshots of the questionnaire and send it out, but it would just definitely help sending it out to people. And I know you can share the link and whatnot, but just from a point of control standpoint, when we are in a larger organization, it's better, in my experience, to just have one person kind of handle that process. So that was just to add some context on the PDF piece. And then my question was more generally speaking, like what was the process or the logic in terms of narrowing down the question set? Just more curious how you decided which ones were kind of the key ones to include or not include.
Hi, Caitlin. How are you?
Hi, Miles.
Yeah, we try to include the things that we think have the biggest impact, but we also look at things which are doable. So it's kind of I suppose looking at both those things, like what can you do that has a big impact, that it's not going to cost a ton of money and is relatively doable? That is probably the main theme behind all those questions.
Okay, thank you. That's helpful.
And Caitlin, look, I mean, this is the pilot. Maybe we missed something.
Can I just add?
Yes.
The questions were actually coming from our climate action working group. And this was a working group that John had on one of the slides. We invited to participate in the review of this. And so a lot of people had different perspectives, but in general, that's what Miles was saying, but it just didn't come from us. It came from the advice of several people.
Mm-hmm.
Yeah, you could say there was a pre-pilot, if you will, over the past 3 months with that group.
Mm.
Yeah.
Okay, moving along. Thank you so much. Eddie, I think you have your hand up next. Please go ahead.
Excellent. Can you hear me?
Yep.
Perfect. Yeah, I agree 100% with Caitlin's assessments. But the reason why I actually asked for a PDF copy as well. We're requesting information from multiple departments, and in other surveys, it was very difficult to navigate the form. So you wouldn't know the questions beforehand. So it's, as you're doing things, a question would pop up, which delayed the process. So a PDF copy would be fantastic. I have just two quick questions. One, if we're utilizing the same incognito link, are we not all accessing the same form? And will we not just be writing over other people's responses? Would we not need client-specific links so that each one of us will have their own form?
Yeah, I'll turn that over to Autumn. It's not a client-specific link, but once you start it, it becomes your unique link. But Autumn, you can probably explain it better than I can.
Yeah, so basically when you hit the save button that Laura showed previously, it generates you your own personalized link. And this is the process that we've always done with, or not always, but for a number of years, this is the process that we've taken for the Green Hospital Scorecard. And we've never had an issue. As long as you fill out that first screen with your general information, click save, and then you'll have, it automatically generates you that personalized link. And that's the same for every site. I know it's a little confusing, but I promise if you just do that process, it works out.
Okay, perfect. I'll try that out. And the other question that I had was, how does this align with the Stats Canada survey for commercial and institutional energy use?
I'm going to defer that to Linda, hoping Linda has an answer on that one.
Ooh, I haven't seen that one in a while, but I think it asks you more for specific information on things like energy, energy use intensity. So as we mentioned, we're not doing that in this one because we're doing this as a baseline. We have not consulted with their survey because, again, it's a baseline one. But I think in the next version, we should be looking at that too.
And I would add, if people are doing surveys like Stats Canada, for example, for us to be aware of what they're doing. And we are trying to align, not just in this, but a number of things in our organization with other surveys or other work that's being done. So it's consistent. And so that's something we, as Linda said, as we look at the sort of the deeper dive one, we'll be taking that into consideration.
Laura, I'm on my phone. Have we gotten everything that's come up in the chat?
No, we're still
Okay.
going through it. So
Oh, I see. Okay.
Yeah.
Yeah. All right.
Yep. Okay.
So, okay, can I just, I have one other
ahead,
question?
Yep.
So then again, my hospital system has 3 hospitals. So am I answering this questionnaire as a hospital system or for each individual hospital?
I think the recommendation is each individual hospital, Eddie, because there could be differences between the sites.
Okay, perfect. Thank you.
And I would say for Eddie, and look, welcome to my partners here to jump in as well, that maybe you want to pick one hospital. And maybe we could have some feedback around that, just in terms of making sure that we're getting a diverse groups. I mean, if you've got a large acute versus small rural kind of thing.
John, was there anything you wanted to add there? Or
I think that is a question. I think is the preference is for each hospital, but I think if you would like to start off with one, depending on the survey, and give us some feedback, that will all be part of the feedback process. But I think giving that diverse perspective, and I think as Linda said, ideally if we have each site, and there are differences between the sites, and I think also it highlights a purpose of the scorecard. And what we're doing is that the purpose also is to enable the organization to make choices, right? And as Miles articulated with the Peachtree, the choices are that see where we're at, see the progress, what it is. It could be a simple tool for the executive team of a hospital, right down to the care delivery teams, right? And so it's a tool to help facilitate the discussion about where should we focus our energy in terms of green, and is there something that we can do, and then how are we tracking our progress, and that will come out more in the more comprehensive tool, should organizations choose to do that as we move that along. But really think about this as a baseline to see how we're doing against other people, what are the simple things we can do, and each site, aside from maybe governance and stuff, may have differences, and maybe the first step might be to advocate to get all the sites on the hospitals all at the same level. That might be a starting point. So we're thinking about the feedback about what is the impact this tool will have, meaning how will the tool be used to drive, change within an organization. And part of that change is the more sites and hospitals that participate across the country, the more baseline data or data that we can have to compare either the size of the organizations and the number of beds to like organizations or what people are doing. And this will build on each other. So hopefully that gives some context.
Great. Thank you, John and Miles. Okay, the next question we have is from Shannon. How does this align with the IHF Sustainability Accelerator tool? And Shannon, I'm not sure if there's anything else you'd like to add, but that is the question.
Why don't I take a crack at this, and then Miles, you can join in. So the IHF tool is a more comprehensive or more in-depth tool compared to this. We are looking at how we might align some of the questions. With the IHF sustainability tool. They are working with Deloitte, and in terms of where their data is being housed, and there's a whole data component to that. We're trying to keep keep everything anonymized and keep people holding their own data. And so that sustainability tool is very much probably going to be more aligned with our more in-depth piece. But I think also, as we had talked about, this tool in itself and where we're going with it is aligned with is starting to be aligned with the standards and RSPs, so that there is more overlap in what you're doing in your daily activities.
Yeah, I think we're talking about what I would call the Geneva tool here, correct?
Yeah.
Yes.
Yeah, we do talk and meet with the Geneva group and seeing where there are points of collaboration, essentially. But they are different for sure.
Okay, great. And we have a question. I think, Kiana, your question was answered by Autumn. Michael is asking about the timeline and communication channels for reporting results. So I don't, John, do you want to? I can.
Well, I
help
think,
answer.
yeah, Laura, you had a timeline slide up there,
Yeah.
right? Where we have I think that's the previous 2 slides.
Yeah, we don't have a, yeah. So the pilot will be concluding on August 15th. So no results before then. We will have to get back to you on specific mechanism for reporting results. I was anticipating emailing it directly to the lead person who applied, but perhaps there's another way that we might disseminate that information. So we'll have to get back to you on that, Michael. Not sure if there's any concerns, or Michael, do you have any specific, like just in terms of your communication channel? Okay, great. Super. Okay, any other questions? And a variety of topics today, so this is great.
I think the thing I really appreciate is that, and hopefully everybody else does too, is first of all, we're very appreciative of everyone participating, even in today's call, even for the questions. We are developing something to make it as straightforward as possible, as you've heard, but we're also developing something in which we're probably putting it out there to the group in a way that's maybe earlier than I think in a way that shows that we're trying to develop something with a lot of feedback, and we're not just like developing something and landing it, say, here you go, this is what it is. We've had some pre-pilot work, as you've heard about. We've had the committee, which is about 16 people on that committee giving feedback on the questions. You're part of a group to get feedback representing all different sizes of organizations. We are trying to be very open with to make sure that we're hitting the mark. And I think for some people, it might not seem as comprehensive enough. Some people might feel just right, or we might miss questions. And so that's just something that, and you can tell even by the presentation today, we're actively soliciting information and being quite open and transparent about it. You're hearing people ask questions, we're answering them on the fly. And it's something that we may not have the answers right now, but we may have the answers in seeing what works. So I think this is a great opportunity, is to solicit some feedback about the process over the pilot. We've had some channels of ideas about, we've had this webinar, we have office hours, we have where people can drop in and ask questions. We're having email that people can submit to. How, and maybe if people answering on this question here, we'd like to solicit from you, how is the best way to support your team during this pilot process? What does that look like? And we may not have thought of it, but we're trying to be open and figure out different ways of communication. And so what is that, specifically, what does that communication look like for you? That would be in addition to the channels that we already have. Once you've seen the tool, what does that look like? And are there different channels that we would we should be exploring?
And I also think, John, adding to that, do you need information to help share with your organization as well? That would be helpful to know. What types of information? Who are you communicating with in your organization about the pilot? Things like that. We heard loud and clear a PDF version is needed, so that's fantastic.
Yeah.
Okay.
And that, I think what Laura is saying, like, making sure that if you need tools to communicate within your organization, it's helpful to understand who you're communicating to, how you communicate, because we're just trying to solve problems in terms of how to make it as easy as possible for clients. And that may be like, I just need like a screenshot of this, or I need a one pager, or I need a quarter of a page, or something that fits in. I don't know what that is, but I just want to make sure that you have, we understand people's needs on how to be successful, and in both communicating the tool and your role in it, and how this may be used.
Yeah, I think everybody understands the confidentiality element here. This is top secret stuff. You folks have all basically just joined the CIA. And I'll go back to the IHF Geneva question. We know what their big titles are. They know what our big titles are, but we haven't fully shared all the questions back and forth yet. Just to sort of give you an idea. Yeah, that's. I suppose that is in response to PDFs going out.
Okay, so thank you so much. And just on the last slide, if you think of anything afterward and you're just thinking of it in the next few minutes, please feel free to use the QR code, and that will email us at our climate inbox. Thank you so much, everyone, for joining today. Really appreciate your participation. Again, you're really leaders in this space, and we're really excited to get your feedback on this. So thank you. Thank you, Miles, John, Linda, Autumn, everyone in the background. Thanks so much. Have a wonderful day.
Thank you.
Thank you.
Thank you. Take care.